That's a really good question because what that really asks and talks about is liability. Um, there's been so many unethical things done with products over the last probably 100 years that whenever there's a major change in society, I mean, look no further than cigarettes or gasoline from the last 5 or 6 decades. I mean, they were fighting in court on gasoline with different additives like lead on whether or not it was safe or whether or not it was not. That's the reverse end, arguing something that isn't safe is. Um, and it's really the same with cigarettes. They've argued for decades that cigarettes are in fact safe and that, it was all in people's heads until the last, 20 years or something, 15 years. They started to really get some traction on that. There's going to be studies, and there's going to be a lot of studies on e-cigarettes, probably going into the future for a long time. And I don't think they'll really ever definitively get an answer to this product line that someone is willing to stake their reputation and name on for at least another 10 years. What you really have to look at is what's the overall statistics of people. How many people have been diagnosed with an ailment that's been directly connected with an e-cigarette or with a juice or something like that. And how much research is going into the actual juice itself. There's a lot of talk about different types of carcinogens that are in e-cigarettes and different chemicals to avoid, your acetones and the different families in that, and your diacetyls and so forth. But I think the real concern is, propylene glycol, vegetable glycerin, and flavoring. How much are people really consuming with that? Was an e-cigarette really designed to be safe when you vaped, a mil or two a day at a really high nicotine strength? What changes when you start vaping 40, 50, 60 mils a day at a very, very low nicotine strength? These are the questions that are going to be answered over the next few years. I don't think there's any debate on the fact that the product is far safer than a cigarette. I think that's very clear and very understood by people. But as society changes it and adapts it, and look how much it's changed. We went from a 5-watt device to a 500-watt device in the last year or two. We've went from smoking a couple of mils a day, maybe 3, to smoking 30, 40, 50, 60, 70, 80 mils a day, depending on the person. I've seen someone take 5 mils of liquid and vape it in a couple of puffs, just making these ridiculous clouds. Those are extreme things. And that's why there's so many studies and reluctance to make any sorts of claims with the product right now, because it's still evolving. The cigarette stayed relatively static. It was about the same size. It was about the same, thickness and tube and so forth. And so they were able to study that. But you start a study on e-juice, and 6 months later, it's completely different because the way the product is being used is different. So I think that's the best answer I can give you on the subject. Overall, I believe in it a lot. I believe that the e-juice market is safer and better. And really, it's going to be the same thing as all products in life. It's to be used in moderation and properly. And when you start taking it to the extreme levels that can be done, I don't know where that leads us. Could very well be perfectly safe, and I could be being silly here. It could also be a higher risk, and I wouldn't know either. Well, e-cigarettes are certainly curbing tobacco use. I mean, there's thousands of people that don't smoke tobacco anymore that smoke e-cigarettes. So in terms of reducing the number of people that are smoking tobacco, I mean, I think that's a given. I think it's tremendously hurting that. I also think it's really making an impact on different types of brands, smoking cessation devices, probably gums, oral sprays, those types of things that people use. So yeah, I think it really is impacting the use of those products a lot. But this is where another debate comes in. Well, we're switching A for B. We're switching apples for oranges. Is it better? Is it worse? Is it safer? Is it not? It's certainly cheaper. It certainly tastes better. It certainly has a lot less health risks involved with it. And the money is certainly going into a lot of smaller companies and up-and-coming businesses rather than a large tobacco conglomerate. And it certainly is the most effective way of getting people to stop smoking a tobacco cigarette. I mean, I don't think anybody could argue with that. The amount of people that are switching over are ridiculous. I mean, it's by the thousands, right? So I would tend to say it's helping. I would tend to say it's helping a lot. With me personally, I mean, even to this day, I can hold my breath for, a couple of minutes underwater. I smoke constantly. I can jog and run and be comfortable that way just fine. I can work for hours and hours of hard labor, and it doesn't bother me like it used to when I smoked tobacco. So I certainly have a very real perspective on how it's changed my life and how it's improved my health. And frankly, I like to smoke. So if you like to smoke, I think it's the best solution for being able to do that and not destroying your body in the process.